Hold on. Hello everyone, we're live from West Valley Hospital and we have Dr Kunasingam.
Hi, how are you?
Live from West Valley Hospital. And hello everyone, we're live from West Valley Hospital and we have Dr Kunasingam.
Hi, how are you all doing?
So Dr Kunasingam is an orthopaedic foot and ankle specialist and we've got a few people joining already, and this guy has been operating on my foot. So we thought we'd do a little live. Dr K will tell you exactly what it is that we've been doing, and we'll do an unveiling. Oh man, we've got like 53 people already.
So awesome. This is basically a bit of surgery to Giles's forefoot. It's affecting his bunion. He had a great big bunion over here.
Massive bunion.
It was like a boomerang. And it was rubbing on shoes and footwear and causing pain and discomfort. So the only indication for surgery there is pain, either on the bunion area here, or the big toe rubbing on the second toe, or the second toe sometimes rubbing on the other toes. And actually it can become so bad that patients can come in with a dislocated second plus or minus third toe. And that's all because of the bunion, which may not be causing pain. So it's really good to assess the whole foot.
Can I just ask you, Dr. K,
absolutely.
How, because I think it's really important, because we're hitting over 100 people already. Can you just explain what is a bunion? How does it occur? Is it because I've been wearing high heels? Is it because I've been doing ballerina moves? What's the cause? Just so that people can sort of understand what the situation is.
So it's essentially genetics. It is genetics, and it's something that there's someone in the family. It can skip a generation. It may just be a spontaneous thing, but it's something that's passed down rather than due to footwear. Okay, look, there are some situations where really constrained footwear may have a bit of an overlay to it. But generally speaking, it's just the way you're built, and it's one of those things. And then it's actually the first metatarsal here, so which I'll draw on here like this. So you've got the head of the metatarsal over here, and it's shifted out like this over here. So that's where it kind of used to be. So you've got the shaft and the head there, and we kind of need to get it into a straighter position and then line it up with the two building blocks here of the big toe itself. So what I essentially do is break the bones either side of the big toe joint. So the joint's actually over here like this originally, and then we shift it in this direction here and this direction here. So make a little cut there through a tiny stab incision, which is there, and then move the bone across, and then I pass 2 screws to catch the bone. So the way I analogize this is an ice cream cone, and this is an ice cream, and we're about to knock the ice cream off the cone, so we just pass 2 screws on there to catch it. This is all through the keyhole, minimally invasive or less invasive approach. Then you've got your 2 building blocks here, and as you can tell, I like food analogies. So the analogy I use here is I take a little slice of cake out of here and crack it down. So basically, it changes the orientation of the toe. And at the same time, Giles's big toe was pointing around the corner. It was pronated, that famous word that we like using, and it was turned around the corner. So I managed to de-rotate it, so his toenails are now looking in the right direction, which is great for the geometry of the bones as well. So there's 1, 2, 3 screws in here. A little bit about if you see patients or you're a patient yourself and you've had a bandage like this put on and it's feeling a little bit snug and tight, you can always slip a pair of scissors. They don't have to be great big trauma scissors like this, but a pair of scissors down the side, layer by layer, to try and cut through these. Because the wounds are on this side, this is the clean and sterile area, but by decompressing some of this ring, you can open it up and take a bit of pressure away. What's also perfectly normal is bruising around the toes. You know this is normal because there's been no pain, which is great. Giles has kindly documented all of this, got to the gym, got going, and there's a lovely flicker of his teeth.
Actually, Dr. K is one of the best surgeons I can speak of, because he's the geezer that was like, surgery's on the Wednesday, get in the gym on the Thursday. He was all about movement, loading, getting confidence, obviously with guidance and under supervision if needed, and obviously to your own limitations, but really keen about exercise rehab being fundamental as part of the rehabilitation process from day one.
I think it's really important, actually, Charles, and you touched on a couple of points there. So you're a young, fit guy who wants to crack on and get going. This is really important, and actually exercise is part of your life, it's part of your well-being, so why then take that away? So even if you thought, actually, it's a little bit sore, you're nervous, you can still get to the gym with the right kind of advice, upper body, core, lower body. You can do glute bridges with your foot on the floor very easily without disrupting any of this. You can do presses, extensions, curls. There's loads of stuff. The stuff that you did and put online was phenomenal. It was absolutely fantastic. And it's probably more than maybe if you were 30, 40 years older could potentially achieve. But that said, everyone does what they can in moderation. And the key here is to have the right sort of support. So either a strength and conditioning coach, a good physiotherapist, and you must take the advice from me. There's a small handful of patients where the bone is quite thin. They're a little bit older, mostly women, and the bone just gets a little bit thin, osteopenic, slightly osteoporotic, and we need to protect them a little bit. They still go into shoes at 2 weeks. They can still go into the gym the day after surgery, but they just have to be a bit mindful about loading up the foot. That's the only thing I'll say. That doesn't mean they don't go for weight bearing. It doesn't mean they can't wear the flat strappy shoe, of which I'll just pull out there to show everyone the footwear. So
I've been wearing this bad boy for the last 7 days. The ladies love it.
Sponsored by Nike. This is a very, very firm base, so it doesn't allow you to bend through it. And that's a little bit limiting. You can get them where there is a little bit more bend in the base, and actually that allows you to get a little bit of movement in the joint as well. But the important thing here is the profile. It's incredibly low profile, not the big offloading wedge shoe. With the open surgeries, often the cuts are longitudinal and you need to protect those a little bit more. So hence you have the big offloading shoe, but that can then put your hip, knee and back out of balance. So just please be aware of that. At the same time, we've gone from crutches to no crutches anymore. So crutches have been dropped essentially for patients. They're full loading, trying to get that normality back. So when you stand, everything stretches, right? So you feel that kind of big give in the morning. So I want the capsule to stretch to where it was. I want all the ligaments connecting the bones together to stretch to where they were. Hence the full weight bearing early. The way the bones are locked is such that the ice cream has been caught and will not come back off the cone. Okay, so it's a really nice stable correction. So, without further ado,
it's like Christmas.
We're going to do the big reveal.
This is where we look at getting my foot all.
It's a little bit of a cut here, okay, on the side, and then we'll take this apart. So, you tell me how comfortable you are as this goes through.
Yeah, fine, no problems at all.
Okay, great. You can see it's very firm here, very thick bit of.
To be fair though, like I said, I had the surgery 7 days ago and I was walking literally the same day, training Thursday, and I've been really focused. And this is what I say with my patients. I really want them to be active in their recovery. And it's really important that you get a good dialogue with the surgeon, good dialogue with the physical therapists, so everyone sort of works together.
So it should be tickling your foot a little bit, but you might be seeing a bit of relief there. So you can see, and I'll show you the layers, essentially is this. I'll show you the anatomy of the bandage. So the bandage itself has got the pink tape around the top, and then you've got the stretchy, crepey bandage itself. And then underneath that, you've got this wool, which is nice and fluffy and soft, and it just protects the foot. And you can see a peep of blue there. So the blue, and it doesn't have to be blue, but there's a gauze that I use around the foot as well. So these are very common in all foot and ankle surgeries, and I'm just showing you because it's quite nice to know exactly what's under your bandage and what's going on. So number one, have a look at this. No swelling. Okay, it's brilliant. You can see the normal architecture of Giles's foot. In fact, you can still see the little arrow to X marks the spot. Bruising, perfectly normal. And very careful not to put the bandage over the little bunionette area. And now that the foot's decompressed, i.e. this side is straightened out, I don't believe this necessarily needs to be done. So that's not something that always needs to be treated. So let's say goodbye to my lovely little drawing here. And let's get these off. And you can see I've protected the toe quite a lot. One thing you will expect to see when the bandage comes down is a little peace sign, a little gap between the two, okay? And that's perfectly normal. It's because of the bandage. So you can see this big, thick wadding coming off, okay? I'll just peel that back there, a bit of freedom, okay? Next layer coming off, a little bit of moisture through there, okay? A little bit of dry blood. All of this is perfectly normal, okay? Let's get this off like this, take all this back like that, and then I'm going to take this down here like this, okay. And now you're seeing really a lovely profile of the foot, and we should show this because on the inside of the foot here, this is just dry blood. There are pinpoint or keyhole incisions here, and this is dry blood, so that hardens up as opposed to the soft bandage there. And that can, as you can imagine, dig in a bit and cause some shooting pain. So that's something to bear in mind, and I'm happy to debulk these early if that's the case. So these can be quite comfortably peeled off, revealing a bit more.
No discomfort at all. There is literally no pain, no discomfort whatsoever. In fact, like I said, I haven't had any pain meds at all.
You feeling nervous?
Yeah.
A little bit more, and now you can see peeping through the steri-strips. I don't use sutures to close. I use steri-strips to pull the edges of the skin together. And as you can tell, this is the first time this has been disrupted in terms of taken off. So we don't know what we're going to see, do we?
Mm-hmm.
Let's have a little look and see. So we'll peel all this off. These are the steri-strips here. So underneath here, first little cut. Okay. Second little cut. A little bit of wet skin, which is perfectly normal, and that will dry out. So there's a cut there, there's a cut there, there's one of those is a cut, and these two are cuts. And we're going to give this a little bit of a clean up, and all of that is going to disappear. Have a look at the foot from the top now. So you can see a nice straight contour. This is what's going to happen. There'll be a perfectly natural curvature here. These toes will sit down as they are nicely. And I might actually get you to stand up and have a look at that with you putting weight. Fantastic.
Wow, look at that. So this is literally the first time I've loaded my foot. So I'm stood up, no help. You know what, and it feels like one foot, literally standing on one foot, no problems whatsoever. I'm amazed considering there's hardly any swelling at all. Tiny bit of bruising, a little bit of bruising, but this is 7 days after. 7 days after.
Okay, come and grab a seat. And what's important to note as well is that this is all soft. So hang on, I'll try and squidge that in there. So that's just a little bit of swelling. Can you see that? And Giles can demonstrate on his other foot, if you look at the old videos, is that it's exactly the same. As the dressings come off, it's a little bit squidgy and soft around here, and then it sucks itself down as the swelling comes down, which is really nice. So this is perfectly normal and natural appearance. And we'll try and get a picture of the other pre-op foot as well. So just a little bit of a clean up here. Okay, just to get the top layer of blood down. And what I recommend is actually not scrubbing this at all, and occasionally you get a wound like this which needs another 24 hours of a little plaster to go on top, maybe 36 hours, and it'll get a final scab before going into a shower environment. So this looks really nice here, a little bit of a clean as mentioned. Then we'll get some gauze, so voila, and then we'll just give this a little bit of a clean up here as well. So, drying out nicely, very, very nicely. Okay, and bear in mind, the wounds take 10 to 14 days to heal. This is really still healing. So I'm gonna steri-strip these up for the time being. Everyone else would normally get the 2-week wound check, so 10 to 14 days. And this is actually showing you that even as early as 7 days, there's beautiful wound healing, which is great. So we'll get a couple of dressings on there, okay? And just a second.
Look at that, eh?
I'll steri these up in a second.
Yeah.
I'll put a little upside on there, just to protect it. Comme ça. Okay. And then we'll get some steris on underneath these. I'll take these off and get some steris on here and here. And those are your 5 little incisions. So I'll just put that obliquely across there, like that. But Giles is going to go into a training shoe now, so stretchy training shoe with laces. Laces mean you can open up the top of the shoe. Stretch means it can give to accommodate for swelling. One thing that's really, really helpful at this stage, be it 1 week like Giles, but most likely will be a 2-weeker or seeing 2-week patients. Thin sock over the top. This is what a patient told me. I can't take credit for it, but it's a wonderful tip. To get a gel wine cooler. So something goes on a wine bottle or another bottle that we might put into the fridge, cordial for example, and you put that on top of it. You can take that out of the fridge and it's flexible, so it can slide onto the foot and stay onto the foot. It's quite nice, patients quite like it, so give that a go as well.
Awesome.
I hope you've enjoyed the
brilliant
big reveal. And we'll do another reveal a bit later once the wounds are fully healed.
Fantastic. Right, say goodbye.
Cheers, guys.
Take it
Bye-bye.
easy, guys.